Good morning, everyone, and welcome to the first session of our summit series, the 10th annual New York State Action Coalition Future of Nursing Summit. And we are building on a decade of success. I'm Deb Elliott, and I am joined by my other co-leads, Deborah Stamps from Rochester Regional and Kathy Galla from Northwell Health. I'm with the Center for Nursing here in New York, and we are going to get started. We're so glad that you're joining us. This is an exciting time for all of us, and we have a great program for you today. I'd like to first start by being thankful and grateful to Rochester Regional Health Nursing Institute, who has provided the CNE for professional development for registered nurses for this program and the whole series, the next two series sessions, at no cost to us. So that is, thanks to Deborah Stamps and her crew and her team. Really appreciate their generosity. So in order for us to provide the CNE, I need to read you the statement. The Rochester Regional Health Nursing Institute is an approved provider of continuing nursing professional development by ANA Massachusetts as an accredited provider by the American Nurses Credentialing Centers Commission on Accreditation. Completion of this program will award 2.0 continuing nursing education credits. To receive professional development credits, you must comply with the following. You must be signed in and sign in on the roster, you must be registered, remain for the entire presentation, and complete and submit the presentation evaluation form. The speakers and members of the committee declare no conflict of interest. This activity has no commercial support or sponsorship, and this activity is not co-provided. So with that, going to the next slide. Okay. We're going to give you a brief overview of the New York State Action Coalition. I'm hoping that some of you have heard of the New York State Action Coalition before. If not, this is going to be just a brief overview of how we started and some of the accomplishments that we've had. But first, I need to just recognize some of our sponsors for today's program. The Future of Nursing New York State Action Coalition is housed at the Center for Nursing. Rochester Regional Health, Northwell Health are also supporting the Action Coalition with Deb Stamps and Kathy Galla as the other co-leads. We have support from the New York Organization of Nurse Execs and the National Association of Hispanic Nurses. And so we really appreciate all the support that we get from our sponsors and our partners. I'm having trouble advancing the slide, Deb, I'm sorry. Okay. The Future of Nursing New York Action Coalition, New York State Action Coalition, was actually formed in October of 2010, right after the first Institute of Medicine Future of Nursing report was published. And this is the mission that the steering committee at that time, there was a great group of colleagues that came together to start putting together the Action Coalition after the report was published. And this is what we decided we were going to do. We were going to facilitate and provide leadership for the implementation of the first 8 recommendations that were set forth in the IOM report. And our vision was that all New Yorkers will have improved experiences of healthcare, higher levels of health, and lower healthcare costs. And so we've been working on this since 2010, and these were some of the goals that we were hoping to accomplish, and we made some significant progress in the last 10 years. And really with a focus on those recommendations and streaming them down to where we could put them into action in our state. And just a little list of a few things that we've accomplished. Oh, first I wanted to show you the map. In New York State, we actually divided our NYSAC into regions. We have, there are 7 regions across the state, and we've tried to get action coalitions, regional action coalitions in place in those regions. Some are more active than others, but it really helps to bring together groups in those areas to work on certain projects, such as the Central New York region has been very active with one of the accomplishments that we have been working on since 2011, and that is the New York State Fair. Here's a couple of our accomplishments. We have annual summits. We've been providing annual educational summits every year, and they get larger and larger as we recruit more and more folks. We have monthly meetings with our steering committee, our leadership team. We've done a doctoral study back in 2012. We have a booth at the New York State Fair every year, which is a Future of Nursing booth, which attracts not only nurses that come to the fair to learn more about what we're doing, but it gives us an opportunity to speak to the public about healthcare. And we've done some studies with some of the results. We've done some surveys with the public. Unfortunately, we didn't have our booth in last year in 2020 or in this year of 2021 because of the pandemic, but we will be hopefully resuming that in 2022. We were also the recipients of an Academic Progression in Nursing grant, an APIN grant, for 4 years. That was provided through Robert Wood Johnson Foundation, and that allowed us to replicate a 1-to-1 model of associate degree baccalaureate nursing throughout New York State. It was a very successful program, and those models keep on being developed throughout many of our associate degree and baccalaureate schools. We have a very active New York Nurses on Boards Committee, which has been, it's been really good about not only educating nurses about how important it is for us to serve on community boards, on state and national level boards, because nurses bring a very different perspective to the conversation, and they've done an excellent job recruiting and meeting that need. Back in 2015, we developed a diversity toolkit under the direction of Dr. Kenya Beard, which was distributed far and wide. We are in the process, our DEI committee is in the process of reevaluating that and updating that. And in 2017, we developed a professional nursing guide for school counselors to educate school counselors on how to recruit young people into the nursing profession. We found out, we had done a survey of that group and found out that they really weren't aware of what nurses do and what education nurses need. And so that was a very useful tool that has been used throughout the state. And we've also, in 2020, we developed a mass campaign, which was called Wear One, Share One, Spare One. And that was really to have for nurses to take the lead in encouraging the public to don a mask to help prevent the spread of the pandemic. And that's just a snapshot of some of the things that we've done. And then just to that's a quick wrap up of what's happening in New York with the Future of Nursing. This is for more information. There is a website that you can get to see a little bit more about what we're about. The co-leads, here are our emails, so that if you want to reach out to us, we would love to hear from you. Then there is an area on the website that a form that you can fill in if you're interested in learning more about the New York State Action Coalition. And Kennedy Blanchard is our communications person who mans our website. We also have a Facebook page, which is manned by Lucia Alfano. And we hope that some of you will consider joining our group, because we really have a lot of work ahead of us. With that, I'll turn it over to Deb Stamps.
Thank you so much, Deb. Good morning, everyone. It is my pleasure to introduce Dr. Susan Hassmiller. Susan Hassmiller is serving as the Senior Scholar in Residence and Senior Advisor to the President on Nursing at the National Academy of Medicine from January 2019 to August 2021. In this role, she serves as a key member of the leadership team for the report, The Future of Nursing 2020-2030. Charting a path to achieve health equity. that was released in May of 2021. She is also the Robert Wood Johnson Foundation Senior Advisor for Nursing, and in partnership with AARP, she directs the Foundation's Future of Nursing Campaign for Action. This national initiative advances the recommendations of the Institute of Medicine report, The Future of Nursing, Leading Change, Advancing Health. Dr. Hassmiller serves as the report study director. Dr. Hassmiller has worked in public health settings at the local, state, and national levels, including the Health Resources and Services Administration. She taught community health nursing at the University of Nebraska and George Mason University. Dr. Hassmiller is an elected member of the National Academy of Medicine, a fellow in the American Academy of Nursing, and sits on other advisory committees and boards, including the Hackensack Meridian Health System, United Health, Carrier Clinic, Nurses Everywhere, and the American Red Cross. She is the recipient of many awards and 4 honorary doctorates, but most notably the Florence Nightingale Medal, the highest international honor given to a nurse by the International Committee of the Red Cross. It is my pleasure to welcome Dr. Susan Hassmiller. Dr. Hassmiller, we just have to get you off mute here. Just a minute. You're still on mute.
Okay, there we go. I'm set. Okay, I was thanking everyone. So let me get back to my, there we go. And just takes a little bit longer with our Zoom setups, doesn't it? Let me just see here. Okay. So thank you again. I was so glad to hear from Deb Elliott and all that has been going on. A quick snapshot, as you put it, Deb, of the New York State Action Coalition. Really so proud of what you have accomplished with our, Institute of Medicine Future of Nursing report and all that you're going to do. I have so much hope. So let's get started here. I'm delighted to be with you today and grateful that the New York State Action Coalition has actually organized a series of meetings to showcase how New York nurses are advancing health equity. And thanks to those of you who have been on this journey to improve health through nursing and those who are just beginning the journey today. Thrilled to present to you the findings from the new National Academy of Medicine report, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. The report arrives at an inflection point for the nursing profession. The past year has increased our visibility, but it's come at a great cost. Nurses are emotionally spent from caring for COVID patients. The pandemic has also laid bare the stark inequities that have persisted across our generations. The decade ahead will demand a stronger, more diversified nursing workforce that is prepared to provide care, promote health and well-being among nurses, individuals, and communities, and address systemic inequities that have fueled wide and persistent health disparities. The report is aspirational and ambitious, and the future of nursing during the next 10 years will be about creating a more fair and just world for everyone, and you all will be helping to create that world. Next slide, please. This report is the second major report released by the National Academy of Medicine, or NAM, on the future of nursing. The first report pictured on the slide, hopefully all of you recognize this, or most of you recognize this. It reconceptualized the role of nurses in transforming the healthcare system. The Robert Wood Johnson Foundation, my employer, and AARP believe that the recommendations in this report were far too important to sit on a shelf. How many times did I say that, right? We're not going to let this report sit on a shelf. So we formed the Future of Nursing Campaign for Action, a nationwide initiative to advance the report recommendations. We formed action coalitions. You just heard about your own in all 50 states and the District of Columbia. The action coalitions are made up of nurses and a broad spectrum of partners to advance the report recommendations. The action coalitions across the country have been key to our successes in strengthening nursing education, advancing practice, promoting leadership, and increasing workforce diversity. Together, we built the capacity of the nursing workforce to expand high-quality care to more Americans. This new report builds on the gains that we have made over these last 10 years. Next slide, please. As the nursing field built its capacity, we started to ask at Robert Wood Johnson Foundation, all this capacity, still building it, yes, but to what end? To what end are we going to put all this great nursing capacity? We knew that Stark Health Inequities existed in the United States, and we also knew that nurses have a long history of tackling the many social and economic drivers that affect health. Nurses are the largest and most trusted segment of our healthcare workforce, and they work in a range of settings and are often the first and most frequent healthcare contact with individuals, families, and communities. In 2019, RWJF asked NAM to chart a path for the nursing profession to reduce health inequities and improve the health and well-being of the nation. NAM planned to release a consensus report in December of 2020, but then something happened. We all know what that was, the pandemic, followed by renewed calls for racial justice. And we realized that the only way for this report to be relevant was to delay its release to incorporate the pandemic's lessons, the devastating toll it's taken on our nurses, and the ever-growing calls for racial justice. The report is being released during a critical time in our nation's history and in nursing, when it's clear we must dismantle structural and interpersonal racism to eliminate inequities. Nursing needs to be at the forefront of creating a more fair and just world, and we need policy reforms to unleash our potential. The report's vision is audacious: the achievement of health equity in the United States built on strengthened nursing capacity, diversity, and expertise. Next slide, please. Achieving health equity is the most salient issue of our time. Achieving health equity is the most salient issue of our time. And this is nursing's time to help lead this charge. Our country has long failed to give everyone a fair and just opportunity for health. Health is greatly influenced by access to jobs that pay a living wage, safe housing, reliable transportation, walkable neighborhoods, good schools, fresh food, and adequate green spaces. Factors like our race and ethnicity, income level, sexual orientation, disabilities, and the conditions where we live, such as in rural areas, predict whether we are more likely to suffer from preventable, costly medical conditions and live shorter lives. Next slide, please. Compared to white people, Black and Latino individuals are more likely to live in neighborhoods, have more pollution, and lack healthy food options, green spaces, places to exercise, and safety. This is due to structural racism, defined as a system in which public policies, institutional practices, cultural representations, and other norms work in various, often reinforcing ways to perpetuate racial group inequity. Next slide, please. These structural inequities and racism experienced by people of color on a daily basis leads to stress, poor physical and mental health, and the advent of chronic conditions sooner than white people. These factors also put Black and brown people at higher risk for COVID, as you have come to find out in New York for sure. Low-income individuals, next slide, please, slide 7. Low-income individuals and people of color are more likely to live in crowded housing, rely on public transportation, and be those essential workers we heard so much about. They are also more likely to lack health insurance and less likely to be able to access care. This has made it difficult and often nearly impossible to follow recommended social distancing guidelines during the pandemic and puts them at a higher risk of getting sick or dying from COVID. Next slide, please. The brutal killings last year of George Floyd and Breonna Taylor by police officers and Ahmaud Arbery by armed white men while he was out for a jog underscore the need to adequately acknowledge, confront, and dismantle all systems of structural and interpersonal racism, including within nursing. We must all commit to a more just future. This, ladies and gentlemen, is the future of nursing. Next slide, please. The report is intended to meet this moment. It contains 4 takeaways and a series of recommendations to unleash the potential for nurses to achieve health equity. These recommendations are the consensus of the committee based on the evidence. RWJF is still thoroughly reviewing and digesting the report, and we encourage leaders throughout nursing and healthcare to do so as well. Next slide, please. The report calls on the systems that educate, pay, and employ nurses. Are you in that crowd somewhere? To do the following: permanently remove barriers to allow them to do this work, value nurses' contributions, prepare nurses to tackle and understand health equity in the first place, and fully support nurses. The need to dismantle structural and interpersonal racism and diversify the nursing workforce is woven throughout. Now let me discuss each briefly. Next slide, please. Slide 11. Many people in our country can't access healthcare because they lack insurance, the ability to pay, and clinics or providers in their geographical area, particularly in rural and inner city areas. Nurses can help bridge the gap in access to care. About 70 to 80% of all advanced practice RNs work in primary care. The nurse practitioner field has grown while the number of physicians, as we know, going into primary care has remained stagnant or declined. Studies have repeatedly demonstrated that nurse practitioners provide care that is equivalent to the care by physicians. They are less expensive to employ than physicians and are more likely to care for vulnerable populations, including those in rural areas. However, their ability to practice fully is limited by state and federal laws, institutional barriers, really important, and restrictive health system policies that prohibit them from working to the full extent of their education and training. Next slide, please. The report calls for all organizations, all of you, to enable nurses to practice to the full extent of their education and training by removing regulatory and public and private payment limitations and restrictive policies and practices. This recommendation continues the work of the first report, but it discusses in more detail lifting barriers that prevent all nurses, all RNs, all licensed practical nurses from practicing to the top of their education training. These range from restrictions on providing telehealth services to workplace policies that prevent nurses from providing the best care possible. Until all nurses are permitted to practice to the full extent of their education and training, significant and preventable gaps in access to care will continue. For many people, delays in obtaining care lead to worsening of symptoms and disease progression and to greater costs when people ultimately do receive care. Next slide, please. You're catching me at my morning voice. It takes me a couple of hours to get through this, so bear with me. Yes, here we go. The second takeaway is to value nurses' contributions, including those of school nurses and public health nurses. The current payment systems are not designed to pay for services that address the social and economic drivers of health and advance health equity. They often do not explicitly value nurses' contributions to care. Payment systems can enable nurses to make essential contributions to improving care and outcomes for all patients when they support team-based care, improved communication between providers and patients, and proven interventions and strategies that can reduce health inequities. Nursing roles to advance health equity will only be scaled up if they are valued and paid for. Private and public payment systems should be intentionally designed to support and incentivize healthcare and public health organizations to enable nurses to perform these roles. Next slide, please. We need to do a much better job of educating nursing students so that they are prepared to promote health equity. Students need to be better prepared to understand and identify the complex social and environmental factors that affect health, effectively care for an aging and more diverse population, engage in new professional roles, adapt to new technology, collaborate with other professions and sectors. That is really key. Multi-sector collaboration and adapt to a changing policy environment. Collaborating with partners outside of healthcare will be particularly important in the next decade, including organizations focused on housing, transportation, social isolation, and food insecurity. And I would say health equity. A strengthened nursing field will be critical as baby boom nurses continue to retire this decade. Next slide, please. Developing a more diverse nursing workforce will be key to advancing health equity. The report calls on the nursing field to address systemic racism and bias within nursing and prioritize diversity and cultural humility, defined by flexibility, a lifelong approach to learning about diversity, and a recognition of the role of individual bias and systemic power in health care interactions. For too long, the nursing profession has identified as being a caring profession and maintained an identity of color blindness. Color blindness was admirable in its intent, but it was wrong. It unfortunately made us blind to the structural racism that has long existed in this profession. We need to acknowledge and confront structural and interpersonal racism in nursing so that we can address the systemic barriers that keep the nursing profession overwhelmingly white and female. Despite decades of emphasizing diversity, the nursing field remains approximately 80% white, even though white people make up 60% of the population. Here's an even more stark number. The gap widens further for nurses in leadership positions, including in academia, with about 90% of nursing leaders coming from white backgrounds. Next slide, please, slide 16. Right now, content about the social and economic drivers of health, health inequities, and population health are not well integrated into undergraduate and graduate education. Schools of nursing need to integrate these concepts and competencies throughout the coursework. For nursing students, this means that you should start to see more classes like your population health class. Schools should also expand community learning experiences, substantive education in the community, such as schools, workplaces, home health care, public health clinics, and telework settings. Allow nursing students to learn about the broad range of care environments and to work collaboratively with other health and non-health professionals. Those multi-sector partnerships I was talking about, so critical. We also need to increase the number of PhD nursing graduates focused on health equity. Next slide, please. Slide 17. The fourth takeaway is to fully support nurses. Nurses need to feel healthy and well supported in their workplaces to effectively care for people and to advance health equity. But the pandemic has taken an unprecedented toll on the nursing workforce. Before the pandemic, many frontline nurses worked in understaffed settings. They were overworked and burned out. Many worried about bullying and violence in the workplace. Many also cared for children or elderly relatives outside of work. Their stresses have been exacerbated by COVID, to be sure. More than 12,000 nurses participated in a December 2020 survey conducted by the American Nurses Foundation. Most shared they are currently experiencing a higher likelihood of depression, anxiety, and distress from when they were surveyed in spring 2020. During the spring administration of the survey, 50% of nurses indicated they were overwhelmed. These feelings intensified as nurses indicated in the more recent survey that 72% of them felt exhausted. Slide 18, please. Next slide. Fully supporting nurses also means addressing and eliminating racism in our workplaces. Nurses of color repeatedly report experiencing discrimination and bias within their work settings. All nurses need to create a culture of equity in their workplaces, and this especially calls out nursing leaders. Our workplaces should reflect the patient population that we serve, and everyone should practice cultural humility and be aware of their biases. Implicit and explicit bias training and cultural practices are accepted and championed by leaders within the institution where nurses work will be critical. Our workplaces need to recruit, retain, mentor, and promote nurses from underrepresented backgrounds. We need to advance nurses of color to leadership positions where they are sorely underrepresented, as I pointed out earlier. Next slide, please. What the workforce has been through is unjust and unsustainable. We need to tackle the systems, structures, and policies that create workplace hazards and stresses that lead to burnout, fatigue, and poor physical and mental health among the workforce. The report includes a number of recommendations to fully support nurses. The main one is this: by 2021, nursing education programs, employers, nursing leaders, licensing boards, and nursing organizations should initiate the implementation of structures, systems, and evidence-based interventions to promote nurses' health and well-being, especially as they take on new roles to advance health equity. Next slide, please. The report calls on all nursing organizations to work together to create a shared agenda to achieve equity. They should identify priorities for education, practice, and policy to develop mechanisms for leveraging existing nursing expertise and resources. And we'll all be much more successful if all of these nursing organizations collaborate. So just to point out, the Tri-Council includes some of the larger organizations such as the American Nurses Association, National League for Nurses, American Organization of Nurse Leaders, and a couple of more. So those organizations are used to working on their own by themselves. They have a lot of work to do, and many times they come together as a council to do their work. This recommendation is asking all of those organizations as a Tri-Council to leverage the experience of the Council of Public Health Nursing Organizations, which includes public health nurses and school nurses, community health nursing educators. Those are the nurses who have been living in this space for the longest, I would say, and understand the language of health equity and social determinants. And also to leverage the experience of those in the Federal Nursing Service Council. Those include nurses in the armed services like the Army, Navy, Air Force, and the unarmed like the US Public Health Service and the American Red Cross, and the Veterans Administration. And then, of course, to leverage the experience of our Minority Nursing Association. So I think you can see, you can understand with the agenda that we have before us, why we're calling upon all of these nursing groups to work together and then reach out to those other sectors that I was talking about, representing the social determinants. Next slide, please. The next decade offers tremendous challenges and opportunities for the nursing profession. More than ever, we need to tap the full potential of all nurses in every setting so that we can achieve what our country needs for everyone, no matter who they are or where they live, to be able to experience health and well-being. Don't you think we all deserve that? I believe that. New and established leaders at all levels and all settings are needed to lead the change that results in meeting social needs, addressing the social and economic drivers of health, and ultimately achieving health equity. If you're not already involved, please join the New York State Action Coalition. They are up for this challenge. I know the leaders are going to do this. Please help them chart a path to achieve health equity. Last slide, please. I thank you for your attention. I'm very happy to answer any questions. What I'm asking people to do normally during these presentations is to sit back and think for a moment about what I said that most resonated with you, anything at all. And I really want you to do this. Go to your chat function and start putting in what most resonated with you. What did you like? What did you feel inspired to do? What do you think is going to be really hard? So just start commenting. In the meantime, I'm asking you to go to the National Academy of Medicine website and sign up for the listserv, because what I'm doing now, I'm working with my team at the National Academy of Medicine on a whole host of resources for you. We have a toolkit that went live last week. We have some slides we're developing. We have some one-pagers. We're going to do some webinars to dig deep more into the chapters of the report, and some podcasts. So if you sign up for the listserv, you'll get prompted as to when these everything is free, always. Everything that I do is always free and shareable. So do that for me. In the meantime, I want to see that chat function start to light up, Deb and Debbie. And let me offer some time now for some Q&As. And I don't know if you want to do that verbally, or if you want people to put it in the chat function. I see one person in the chat function so far. Okay, let's go. What resonated with you? What did I say that resonated with you? Okay, so it's early, but people are drinking their coffee while they're listening, and I didn't get to drink mine. So, I'm
We have
going
one,
to
Susan, we have one comment from Dr. Yvette Conyers. She states that these recommendations are great, but where should one start? We usually talk about what we should do, but how do we put this into action? Your thoughts?
Yeah, that's a very common question. So the report is overwhelming. There's over 500 pages, and if you have a good sturdy printer and lots of paper, you can print the whole thing. The books actually will be available they'll be on sale at that National Academy of Medicine website towards mid or late August, and you'll have a nice hardback copy. So where should you start? I would read the first part of the report, the vision, how we're all called to do this. There's a lot of things in between, nurse well-being and education and paying for care. So there's a lot of things to read, but go to chapter 11. That's where the recommendations are. And again, see what resonates for you. Everyone on this webinar today is part of a group, whether you're leading an organization, whether you're part of an organization. I would say start by reading those recommendations and bringing those to your workplace or to your group, and start talking about, again, what I'm asking you to do in the chat function. There's 4 people. What resonates with you? Think about the low-hanging fruit. What can you do? Because I'll be honest with you, I'm reading a book now, and this is not brain surgery, but success, if you want to have success, it's really a compilation of small wins. A very successful person just didn't automatically wake up. Sometimes that does happen, I guess. But most successful people or most successful things happen because of small, achievable wins. So that's what I'm asking you to do. That's where I'm asking you to start. Look at the recommendations, see what resonates with you, see what resonates with the leadership in your organization, and look at that low-hanging fruit. And honestly, here's what we did. We had a summit, and a few of you were involved in the summit. This is what we asked you to do. There were 54 recommendations, and each of you who were involved in our Roll Up Your Sleeve Summit were asked to think about a goal that might be achievable for you around a particular recommendation, and then name the partners that are going to be required to help you meet that goal. Okay, so that's where I would have you start.
Great, thank you.
So we do have a couple of questions that have come through.
Good.
Sarah is asking, what opportunities will be available to support exploring building better curriculum for nursing in partnership with community partners?
Good morning, puppy.
Sorry about that.
No, kids and dogs and cats, I love it all. I do these exercise tapes and the woman sends them to me, and she apologized that her cats were on the yoga mat one day. I said, no, I love it. It takes my mind off of how hard yoga is, let the cats come. So educational curriculum, the essentials, the AACN, the American Association of Colleges of Nursing, just put out the essentials by which they think nursing students should be educated over the next given amount of time, and aligning those essentials with what we are talking about in the report is really important. It's a good place to start. I know AACN is doing that, and other entities, other educational entities are doing that crosswalk. So there's a lot of crosswalks to be done. I know there's a lot of associations who are doing a crosswalk between their own strategic plans and the recommendation. So what financial resources will be available? I'm not sure yet at all. We'll just have to stay tuned. The report is fresh. We'll see. But here's what I'll say too. Health equity, I said this in my presentation, health equity is the most salient issue of our time. And I really believe this. And you know how you can tell? You can go to Robert Wood Johnson Foundation website and see what we're funding. Only health equity, only things around disparities and health equity. You will hardly find anything else. And this is true of healthcare foundations across the country, the federal government, state government, healthcare systems, right, Deb Stamps, are all prioritizing health equity. So financial resources, if there's a case to be made, I would say that funding entities are prime to deliver funding on these areas. What else, Deb? You're on mute.
I was unmuting myself. Yeah, quite a few more questions are coming in and comments.
Good.
Cindy is asking, tapping into every nurse's full potential seems to be a challenge. How can this be done? So, yeah.
Tapping into every nurse's potential. Here is what I would say. I would say that I am going to lay some responsibility on two entities. First, schools of nursing, to really instill that in every nurse graduate, no matter if it's an associate degree, baccalaureate, graduate, instill in nurses that they are key and central, especially around this agenda. The other responsibility I'm going to lay on leaders who are leading healthcare systems, public health systems, anybody who's employing nurses. I really look to you to set a culture of openness, of compassion, of learning. Every nurse in your system should understand that their voice will be heard, and there is a mechanism to hear those voices. Nurses are innovative. We know they are. We know they are by the number of workarounds they do. So if there are means and structures built into, I don't know who's ever heard of a program called Transforming Care at the Bedside. It's a program that I'm really proud of, that I helped develop with the Institute for Healthcare Improvement many years ago. And it was replicated in all the hospitals in New Jersey, and then AONE at the time took it on. So it's been replicated a number of times. But what this program did was it gave permission, the leadership of healthcare system gave permission and encouragement to every frontline nurse to come up with solutions at the front lines that would help their work environment and would help better patient care. And I will tell you something, the innovations were off the ceiling, and so was nurse satisfaction and engagement.
It's a really good point, Sue. And there's a couple of comments about what resonated with them. Jolene said that what resonated with her is the nurses need support to provide the care everyone deserves. Focusing on nurses' well-being is crucial to the health communities. And that was coupled with Natalie, who said incorporating mental stress of COVID has been very difficult on everyone, especially the nurses in lower socioeconomic areas. So yeah, we need to pay much more attention to the stressors that nurses are experiencing and how to really support them better in those areas.
Yeah.
Robert is asking, how would you recommend introducing all of this to students with the thought of getting them involved earlier in their career?
Well, so I already did one presentation for American Association of Colleges of Nursing, AACN. I'm going to do another one, and I'm going to do a presentation for the Organization of Associate Degree Programs. That is my way of saying that hopefully a number of deans, associate deans, faculty will hear these messages, because it has to start with the influencers in schools of nursing. It has to start with the deans. Sometimes I remember in the last report, deans would come up to me, and CNOs would come up to me and say, how do I get my nurses to understand all this? I said, okay, you're it. You're it. It's your responsibility. We have provided this blueprint for everyone, and it's up to everyone to take it on as leaders. And, how else would you get students? Again, it's the faculty, it's the deans, and it's incorporating it into curriculum. We know that, some schools have it across the curriculum. Other schools have pockets of information about disparities and health equity and racial injustices. But it needs to be throughout the entire curriculum. It needs to be the lens by which all nurses operate.
Thank you. Incorporating the mental stress of COVID has been very difficult on everyone, especially nurses in socioeconomic areas. And that was a comment from Natalie. Mm-hmm. Richard states that he is very thankful for the connection you made, connecting the social determinants of health and structural racism that seem to go unspecified in the Future of Nursing report. How do we do a better job connecting healthcare organizations and academic nursing to build partnerships? How do we get them to see the value?
The multi-sector partnerships, yeah. So I know that's something, Deb, you're going to be involved with the other leaders at the New York State Action Coalition. It's going to require nurses to get out of their comfort zones. If we're serious about doing this work, we can't do this by ourselves. Listen, here's a big clue. A lot of people are already doing this work, okay? So it means we either jump onto their bandwagon, so that because they need the voice of nurses on their bandwagon. How many times have we seen boards? And I know that's maybe the next in your series, Nurses on Boards, but how many times have we seen boards, whether healthcare or those that represent health equity, that don't even have a health voice, or those representing social determinants of food security or food banks? that don't have a healthcare voice or a health voice. Nurses would be a great asset. So it means that we also have to look around our communities and state to see who's doing that work. You can just do a Google search. Who's doing that work in your area? I know New York, you said there are 7 regions. Who's doing work in that region around health equity? And just start talking and say, I'm here to help. There's this great report that just came out and we're on board and here's how I can help you.
Thank you.
Kathy is asking, my question relates directly to the DMP role in leading healthcare policy and advocacy. Please comment on the potential of this care provider role in nursing and healthcare impact. Thank you.
Well, the DMP role, we're very thankful for the DMP role. We know that we had a goal in our campaign that we should double the number of doctorates in our country by 2020. Well, that was more than accomplished by the DMP role. I think we tripled or quadrupled the number of doctorates like this, right? Mount McKinley. And then I'll get to the DMP in a minute. But this is why we particularly pointed out the need for more PhD nurses this time, because that continues to go like this. PhD nurses are responsible for the science and discovery and research of our profession. If we don't have more nurses doing basic research around those social determinants and our profession, we're going to be in a lot of trouble. We need those nurses. And then we absolutely need DNP nurses, leaders in our field, to help translate and implement that research and to lead the policy changes that are called for in this report.
Thanks, Sue. Jacqueline is saying what resonated with her is nurses at transitions. So it seems that that's what resonated, that nurses are really at a point of transition. We are coming into, into being needed in many different roles in different settings, and thinking about our own profession differently than maybe we thought about it before. So
that's a great, I say nurses are at an inflection point, right? And in our history, it's another way of saying that. Absolutely. I got goosebumps when I said that. Nurses can do this, but it is a reconceptualization, and we can absolutely do this. One thing I might ask you to do as the New York State Action Coalition is to further inspire people to get around a paper that I commissioned before we set work on this report. And that's a paper by Patricia Pittman at George Washington University. And it was on the nurse's role in achieving or addressing the social determinants. She talked about the history of our nursing profession, working, Lillian Wald, for example, Henry Street Settlement right there in New York, where you all live, really understood firsthand that nobody could be healthy or well if the dad, and it was at that time the dad was unemployed, or if the kids weren't going to school. She recognized that all of these things were so connected, or if people weren't getting enough to eat. She recognized those social determinants and really addressed them firsthand. So bringing that paper into your group, I think, would be really important.
Yeah, we'll definitely look for that. I think I've seen that before, so I'll have to pull it up. Thanks, Sue. Janine Santelli from ANA New York said that in New York, during the emergency, during the pandemic, they took away restrictions on practice, and we need to collect evidence showing that nothing horrible happened when nurses were allowed to practice at the top of their education. We need to continue full practice authority. And we're right there with you, Janine. Yeah, definitely.
Absolutely. And that's one of the recommendations we called for, which was that the scope of practice that was lifted during the pandemic be made permanent.
Melissa was making a comment that in the hospital where she works in the emergency department, 2 Black nurses are evening supervisors, and she can only honestly say that they're the only 2 nurses that I know of in my hospital. So she was just, I think, commenting that there's I don't know where Melissa works, but
What was the comment, Deb?
that in the hospital that she works in, she only knows of 2 nurses that are Black.
Oh, okay.
I believe that's what
Okay.
she was meaning.
I see. Yes. Okay.
Which is honing in on the fact that we need to be really focusing on a nursing workforce that really matches the communities that we're taking care of. That's the whole crux behind diversity.
That's right.
Carrie says the focus on community health nursing most resonated with her. Often nursing curriculum is acute care, skill-based.
Yeah.
All levels of education must be rich in concepts related to ways to advance population health. Also, the focus on advancing the value, especially financially, placed on school nurses is critical for health equity. Good points, Carrie.
Mm-hmm.
Those are good points.
You can see that you all have a lot to work with.
Yes, we do.
I look forward to knowing what you're going to do.
A few more comments. Laura says, feeling inspired to expand high quality care in the lab diagnostic field, especially for patients in rural areas of New York State. So she's feeling inspired.
Good.
Joanne says, I was struck by the low percentage of Black nurses in leadership positions.
Yeah.
What can organizations such as NIONL do, New York Organization of Nurse Execs and Leaders, to help prepare and support Black nurses to become leaders?
And not just Black nurses. I was talking about nurses of all colors, Black, brown, Hispanic, Native Pacific Islanders, Filipino. Okay, so let's just talk about everybody.
Right. And that's what Marie says. How do we minority nurses get our voices to be heard? As you stated, most nurses in administration or faculty are not of minority backgrounds. And that's going to probably be one of our priority areas here in New York, because we know that that's something that we have to work on. We have to find ways for minority nurses to feel included and heard. And just on an aside, we do have an organization that was created a couple of years ago. It's called the New York Nurse Alliance, and it's just a loosely put together coalition of leaders from nursing organizations in New York. And it started off with, the typical leadership organizations, the ANA New York and NIONL and our deans and directors. But now it's grown over the last couple of years and is including the minority nursing organizations in our state, because we realize that it brings such a richer conversation to those discussions and richer dialogue. So we're moving in that direction.
Yeah, so I know we're out of time here, but let me just say that I'm at a time for having to leave.
I know you have to leave.
Yeah, but I will tell you that please accept this gift on behalf of the Robert Wood Johnson Foundation and the National Academy of Medicine. This is yours to do with what you want. And this also gives you permission. How many times did I hear of leaders taking that first blue book into a policymaker's office or a person's office, a funder, saying, this is what it says. We have to do, if we want to achieve, now this time, if we want to achieve health equity, this is what it says. So saith the National Academy of Medicine. So use it as your gateway to permission, and may the force be with you.
Thank you so much, Sue. We really appreciate you being with us and sharing all of your wisdom. It's always a pleasure.
Thank you so much. Thank you.
Bye.
And we just want to let everyone know that we are saving all of the comments that you put into the Q&A, because it'll really help us as we move forward and start really putting together a roadmap of where we're going to take our action coalition next. So thank you. Continue to put comments and questions in the Q&A and in the chat.
Okay, so morning, everyone. I'm going to be introducing our 3 panelists for the next section of our morning together, the exemplars of New York nurses addressing health equity. So our first speaker is Carol Ryan. Carol Ryan is a registered nurse who served in various healthcare settings before opening a community health consulting business. These settings included hospital nursing, orthopedic, pre and post-op, and intensive care, public health with home visiting, clinic work, epidemiology, supervising public health nursing, assistant director, and finally, director of public health for Sullivan County, New York, nonprofit settings, and also community health work. Carol is a community activist, has a lifelong passion for equity, peace, and social justice, and always includes her passion in doing all of her work. She recently completed design and delivery of a training program for state prison staff, which prepared them to run a program for inmates on discovering and utilizing their inner resources, such as understanding hope and dignity. She is on the board of directors of the New York State Public Health Association and serves on its Policy and Advocacy Committee. She also serves on the Sullivan County Public Health Services Advisory Board, the Board of Directors of Maternal Infant Services Network, and is the chair of the Health Committee for the Sullivan County NAACP, and is proud to be on the Committee for Equity and Justice with a nonprofit, Sullivan Allies Leading Together, also known as SALT. Carol, welcome.
Thank you very much. I'm going to request remote control so that I can show my slides. Very nice to see you all. Okay.
Carol, you just click and you should be good to go.
Are we? So how do I get to my slides, Deb? Okay, here we are. Thank you. Am I speaking loud enough? Deb?
Yes. Yes.
Okay. All right. Thank you very much, everybody. It's a pleasure to be here. I'm very excited to be addressing nurses and people that have an interest in nursing. I just want to briefly talk about my background. I started as a single mom going to a 2-year nursing program. Used to be called OC. It was Orange County Community College. Now it's SUNY Orange. Worked in hospital settings for many years. You heard, I won't go back into that. And then when I started in public health, which has really become the love of my life, I decided I wanted to go back for my bachelor's degree. So I went to SUNY New Paltz to a program that no longer exists, which was an RN to BSN program. I'm really sorry that program no longer exists. It was a wonderful program. And some years later, I decided that I wanted to pursue my master's in public health, because public health is really where the rubber meets the road when you're talking about health equity. And I really have a passion for that. So I received my MPH from Johns Hopkins in health policy and management. Yeah, so I think that's it for my background. And here we go. I'm not going to spend much time on this. This was a quote from somebody who spoke about being a change agent. I prefer to call myself an activist. That's all I want to say about that. And how I became the birth of a nurse activist. I just want to tell you a little story about my background, how that happened. I was working one evening when I worked in the intensive care unit. It was an evening shift. We were short-staffed. Somebody had called out, and I got a call from the supervisor, the evening supervisor of nursing, to tell me that somebody was coming to be admitted who was in very bad shape, needed peritoneal dialysis immediately, and was a VIP. And so this person was to get special treatment. Usually we would get those calls from the emergency room when we were getting an admission. So it was unusual to get a call from the nursing supervisor. As you can imagine, the whole issue of somebody having or expected to have better access to care or treatment because of their life circumstance of being important really rubbed me the wrong way. I know most nurses feel that way as well. And I perfectly was willing to care for this person, give the very best care like we gave everybody. I asked for a little more help because we were short-staffed. never got the help. By the end of the evening, this person had received the care they needed, and I had received some criticism that it took a little too long for this person to be processed and whatever had to happen so the physician could start the treatment. So I went home and I was really, really steamed about this for a couple of reasons. I mean, one obviously was the whole concept that somebody should be considered a VIP to receive care that, in my belief, every single person's entitled to receive the very best care. And that's what we delivered in the ICU. So that was one thing that really bothered me. And the other thing was that I never got the help that I needed there. And that put my license at risk, but more than that, that person at risk and the other 4 patients I had to deal with in the ICU at risk. So I was mad. I didn't have a particularly supportive nurse manager. So I wrote to the director of nursing, telling what my concerns were. And because I was young and kind of naive, I copied the whole board of directors of the hospital. You can imagine that didn't go over too well. And I, of course, was reamed out for it. And mostly I embarrassed the director. But the bottom line was that that kind of situation never happened again. And so I realized that as a nurse, I do have a voice, and there is something I can do about speaking up, and that I have a responsibility to speak up. So that was the birth of me becoming a nurse activist. I was going to write a slide about why do I care about health equity, but I realized it really doesn't matter, because I do care about health equity. So I realize it's more important to talk about how do I care about health equity. And that is that I'm led by my own passion in my work. And that's how I care about it. And by staying connected with my community at all levels, whether zip code to state, national, or global community, and to see what is happening, to stay engaged, and to embrace the joy and fulfillment that I get in doing this work, and put it before income, before personal wealth, before power, or before prestige. The best part for me of being director of public health for 13 years, not was that it was an important role, which it was, but it was that I had the bully pulpit where I could speak up and talk about these things that really mattered. Are we doing for time? Oh, 2 more minutes. So I'm just going to really go over quickly some of the work that I have done with a social justice and health equity focus. Started a bilingual outreach program. We had many, many Spanish-speaking people in our community, and we had no person to be a connection for them. There was a lot of mistrust. Many of them were not documented. So we created this position, and a Latino service provider coalition that continues to exist after many years at Public Health. I'm proud of that. Convened a focus group on migrant health issues and obtained funding for a rural minority health assessment report of Sullivan County. Partnered with Human Rights Commission and a documentary on correctional reform, and served on a panel. Also, I didn't put in my slides, but I recall that also created a public showing for the Unnatural Causes video. I don't know how many of you have seen them, which really talks to health equity, an important video. I facilitated peace education program courses for inmates. So you can see some of these were not directly connected to nursing, but all connected to equity and well-being, and have been recently working with the New York State Public Health Association Policy and Advocacy Committee on writing physician statements on social justice and health equity. And currently we're working on universal health care. Did a Zoom forum for NAACP on COVID-19 vaccine because of the low level of acceptance among people of color and the terrible consequences of COVID-19. Moderate a forum on restorative justice for our Committee on Equity and Justice, and some other things. working with community conversations on anti-racism work for myself and others in the community. And as you heard in my bio, I just finished that 2-day training with prison staff, which was very rewarding. And I think I'm out of time now because I promised 10 minutes. This was the Minority Health Report. This is what Sullivan County looks like. And these slides I'm just going to go through. I've been involved. I remain involved in many ways. And this is our Juneteenth celebration coming up. We're going to have a pop-up COVID vaccine clinic. And as chair of health committee, I got that going. So that's it. I know you're going to receive these. This is my contact information, and I thank you very much for your attention. And I'm going to take myself off remote control.
Thank you, Carol. So as you all can see, Carol is a great example, an answer, a living answer to the question as to how does one put some of the recommendations from the report, The Future of Nursing, into action. So we're going to move straight into our next two panelists, and there'll be time for Q&A at the end for all three of our panelists. So our next panelist is the Honorable Dr. Brenda Robinson, who was born and raised in Albany, New York, and is a proud graduate of Albany High School, Hudson Valley Community College, SUNY Poly, and Walden University. She has worked for the Veteran Health Administration for over 27 years and counting. She is CEO and founder of the Black Nurse Coalition, Inc., whose mission is to eliminate health disparities. Could everyone please put themselves on mute? Thank you. She is the City of Albany Human Rights. She's City of Albany's Human Rights Commissioner since 2013, and is also serving her second term in the Albany Public Library Board Trustee and President of the Arbor Hill Neighborhood Association. She is a strong health and social justice advocate. The Honorable Dr. Robinson has held numerous health workshops and public speaking events. She has held many healthcare positions at all levels of nursing. Dr. Robinson has organized the first annual Breast Cancer Awareness Walk in Albany, New York in October 2020, which was the first walk of its kind in Albany, taking place in Arbor Hill. Dr. Robinson has a community virtual telehealth wellness clinic and continues to serve the underserved minority community even during the COVID pandemic and beyond. She has given major contributions during the pandemic and has been a strong, trusted voice for COVID-19 education and the COVID-19 vaccine. Her work on eliminating health disparities began many years ago and continues. Dr. Robinson has a passion for freedom, justice, equality, and optimal health care for all. She was inducted into the Sigma Theta Tau Nursing Honor Society. She had the honor of being the ANA delegate at the House of Delegates in Washington, D.C. She has served as the American Nurses Association Secretary of Individual Membership Division, Federal Executive Association of Northeastern New York, VP, and the National Special Emphasis Advisory Council for 5 years. She's a mentor as well. Dr. Robinson has received many awards and accolades. She was featured on Channel 10 for the entire month of March in 2020 and beyond, after being selected as one of the Capital Region's most remarkable women. She received the first leadership award at City Hall during the Black and Puerto Rican Legislative Caucus from the New York State Nurses Association in 2018. Dr. Robinson has received a leadership award from the Albany County Legislature for her work above and beyond during COVID-19. She has been featured on CNN, as well as Today Women on Channel 13. She has rolled out a new health equity initiative, New York Level Up Now. Dr. Robinson has published scholarly research on non-VA care at the Veterans Health Administration. Her Census 2020 article was published this past March 2020 in the Minority Nurse magazine. Dr. Robinson has worked on many collaboratives, and the most present, the Albany Police Reform and Reinvention Collaborative, mandated by Governor Cuomo. Strong recommendations were submitted for police reform. Dr. Robinson works very hard in her community, the Tri-City area, as well as other states. She partners and supports others as well. Dr. Robinson, thank you for joining us today.
so very much for having me. This is an awesome webinar, and it's just an honor to be here. When I think about the future of nursing, when I think about change, I think about how large this topic is and the great impact nurses have on healthcare. Talking about the future of nursing, we must speak about and acknowledge the past and the present. At the very least, as we look at the past, we must acknowledge the years and decades of unequal treatment. We must acknowledge that disparities in unequal treatment, maltreatment, racism still exist. So today I just want to share a little bit about healthcare disparities, the Black Nurses Coalition, my experience with COVID-19, and maybe a few things that we can do to improve. Healthcare is built on a foundation of systemic racism, which is evident by the numerous healthcare disparities that exist. So whether we're speaking about systemic racism, institutional racism, structural racism, stereotypes, implicit bias, explicit bias, which I experience a lot, stereotypes, micro inequities, macro inequities, all of these terms add up to racism, unequal treatment, as noted by the Institute of Medicine, and poor health outcomes. We all can be a part of this change. Recently, I did a presentation for a nurse practitioner, right? I'm actually finishing up a program, and I wanted to be very interested in this. Was a presentation to urgent care, and the chief complaint was decades of unequal treatment. The HPI, the history of present illness, was millions of Blacks, African Americans, and Latinos present with complaints of decades of unequal treatment. As we went further with the HPI, the history of present illness, the disparities, we spoke about African Americans are twice likely as Caucasians, white people, to die from diabetes. Blacks, African Americans, are 3.2 times more likely to be diagnosed with end-stage renal disease as compared with white people, Caucasians. These are disparities. Blacks are 2 to 3 times more likely to have a lower limb amputation due to diabetes compared to white people. Black diabetics death rate is 39.8 compared to whites at 18.9. That HPI, that racial disparities. When we look at the maternal mortality rate, Black women 2.5 to 3 times more likely to die from pregnancy-related causes than white women. These are just some of the healthcare disparities, even more, that I deal with on a daily basis. A little bit about me. I have a life mission, a vision, a goal to eliminate healthcare disparities, and I work very hard at that, and that is the same mission of the Black Nurses Coalition as well. We are a boots on the ground organization, which is imperative when dealing with minority underserved areas. And I myself live in an underserved area by choice. We provide conventional and unconventional services, meeting people where they are. It's not surprising for someone in our area to see us at a Stewart's taking blood pressures, or at the library, or at the park. We certainly meet people where they are, and that is so important. I have been highlighting healthcare disparities for over 10 years and advocating for health equity, and it's certainly a passion. We provide care where others do not. COVID-19 experience, the COVID-19's impact on the Black community was devastating as we watched African Americans die in droves on TV and social media, piled up high, like in New York City, looking at those bodies, and even Atlanta, looking at the trucks on social media with dead bodies piled up, a lot of folks looking like me. We watched leadership, mainly white, make decisions for us. Unfortunately, it took that horrible death rate of Black and brown people during the pandemic for leadership to acknowledge healthcare disparities on a large scale, as it should have been in the very beginning. Healthcare disparities in itself is a health crisis, and is not new and did not start with COVID-19. COVID-19 did force the conversation. So I guess if I could think of one good thing COVID did was put healthcare disparities up front. Back in March, I was requested to speak, and it was an honor, requested by Congressman Taco to speak on behalf of nurses, supporting mental health funding for healthcare workers, nurses, in regards to COVID-19 pandemic and beyond, because it's a huge impact. I shared some experiences and I spoke about the price that nurses pay. And I really reflected on our engagement from day to day when we continue our engagement, when we continue to knock on those doors when other people did not. When we knock on the door and that 7-year-old who we love seeing and talking to doesn't open the door, and we find out from a family member that she died of COVID. When we speak to a 23-year-old who was threatening suicide because he had some mental health issues and now felt that he was so isolated, being forced to stay in his home. We dealt with folks with increased stress and the fear, the depression, the anger, the helplessness, the hopelessness, the skepticism, doubt, of course. These are things that we dealt with on a daily basis. Chronic conditions such as high blood pressure, wound care continue. These things did not stop because the pandemic came and a lot of businesses shut down. We still have work to do. We still dealt with our family as well when we talk about paying a price when your family is so worried and don't want you to go out because they don't want you to get COVID and die, but you know that you have a passion and you have a community to serve. So some of the things I worked included, we had a lack of inclusion. I felt people of color being in the process, having that voice during COVID-19, especially early on in the pandemic, especially in this area. So one of the things we did was I created a platform. You know, we didn't see people that looked like us on television really communicating and engaging us. So luckily we do have social media. We did have areas where that we can create our own platform. Minorities needed to see and hear from people of color that look like them and folks that they trust. And BNC continues to increase our community engagement and services during COVID-19. We did several different forums. We did Facebook Live. We did all types of social media. I heard the young lady mention about panels. We did several panels. We did several forums for NAACP and a host of other organizations. We partnered with healthcare and non-healthcare entities, which is so important. It's not just healthcare folks that you have to partner with. I even partnered with a meat company. Can you believe it? And I'm a vegetarian. That was different, but wonderful people. I mean, it was a great partnership. Had a Real Talk Live. This was a Facebook Live that I did. And it was Real Talk, and it was folks who come from the same areas that I come from, that I can relate to them and express to them what COVID-19 actually means, how I felt about it, how I initiated, how I did my research to decide which way I was going to go in regards to COVID-19. They felt comfortable in asking me questions, even personal questions, because they knew that they would get a straight, clear answer. The answer as I know it, as per the science. We adapted, we provided individual services, and we met the needs of the community, and we met them at, where they were, whether that was delivering PPE, whether that was doing wound care when so many appointments were canceled, whether that was taking a blood pressure, or whether that was bringing that toilet paper or dishwasher liquid that someone needed. We picked up prescriptions because folks cannot do that, or they were afraid to go out. A lot of them didn't have money for copays. So we certainly met the need. We partnered with Albany Med and did the Don't Hesitate, Vaccinate campaign. We partnered with Schenectady County Public Health. We worked very, very hard in the community, and that being able to provide education, trusted education, where that people of color, minorities could receive what you're giving them is so important, because you have to have that trust. So here comes along the COVID-19 vaccine. We waited for the vaccine. There was so much skepticism, which was valid. We understand that. And that's one of the first things that we have to realize, that skepticism is valid. The chaotic role out of the vaccine was very difficult in the community in which I serve. There were many barriers such as the internet, computer literacy, and those folks who were savvy with the computer blocked up all the appointments. So therefore, when you went to a vaccination site, whiteness. The folks who were getting the vaccine were white. The folks who were the vaccinators were white. The other staff that were there were all white. That wasn't conducive to people who looked like me in an underserved minority community. And it did not give them the encouragement that they needed or the trust to get that vaccine. And I'm a strong advocate, and I advocated for that. And I spoke up about it as well as others. Oftentimes, our advocacy seemed to go unheard, but we tarried on and continued to do what we needed to do. Some of the things we did, we circumvented the system. And one of the things I did was create the BNC Vax team. And as far as I know, we are the only team in this area of Black nurses and others, not just nurses, who vaccinated such a large community in this area. And it just certainly was a pleasure. And it's not just myself, it's other folks who we teamed up with who also, I would say, circumvented the system and also partnered with so many people to help folks get vaccinated. The pods, we had the Army, we had FEMA come here, right? We were in the community making sure that folks signed up and helped them get those appointments at the Times Union Center or at the Armory so that we can get the vaccines. And that was the behind the scenes work. And it was a lot of work. When you hear the numbers and the percentages of folks who get the vaccine, you have to have those boots on the ground folks who are knocking on those doors and, hey, did you get your vaccine? Why are you skeptical? What's the problem? Let's talk about it. You may have to talk to that same person about 3 or 4, maybe even 5 times, and maybe they turn around and say, you know what? I think that is in my best interest. I think I'm gonna get that vaccine. Even with the mask early on, knocking on those doors, sir, you need your mask? I have some for you. I saw you today, you didn't have your mask on. Can I explain to you how important it is? We all have to be socially responsible. These things seem so simple, but it's a lot of work, and it was needed work. In our community, I feel really appreciated it, and they responded well. And we are continuing to do the work. We have vaccinated thousands. We have helped thousands get vaccinated, and it's been very positive. We have had several commercials. We continue to be in the community. I have an office that I'm sitting in right now, which is in the underserved community here in Albany. So, we have to acknowledge where we are, where we're going. We have to acknowledge the racism that certainly exists, because we can't keep going on and acting as though these things are not here and healthcare disparities are now going to have the cover pulled back over and we're going to go on as usual. We can't do that. So what are some of the things that we can do? And I'm trying to stay in my 10 minutes. Acknowledge the skepticism, as I said, and educate ourselves. If you're not aware, if you're that person that's saying, oh, get over it, then you need education. Okay? If you're telling a person of color, get over it, you need education. Okay? So educate yourself. Demand diversity and inclusion. Accountability. Hold people, organizations, leadership accountable. Hold them accountable. Outreach, engagement. You have to engage the community. Even communities that are underserved, you have to engage. That's why we have these healthcare disparities now. Use that equity diversity lens, right? An example, right? If you see a committee and you're discussing equity, take a good look at the committees and task force that you sit on, right? How many people of color do you have on these task force? Especially a task force that's speaking about racial minorities and health equity. How many people are actually minorities? Because we have a voice and no one knows us better than us. And folks have to realize that. Question if people or organizations who are boots on the ground are given a seat at the table. Remember, no solution will be effective unless those who are impacted are included in developing that solution. We need academia and researchers sitting at the table, but we also need nurses with experience in the community to have a bright future in nursing. Bright also means diverse. Mandate education on diversity and inclusion in all areas, addressing racism in all areas in healthcare with purpose. Talk is cheap. Talk is very cheap. Black and brown people are underrepresented in nursing academia and all aspects of nursing and leadership. We need to change this. This is imperative that nursing faculty is diverse. Purposeful movement needs to be made in this area. We need nurses of color, certainly, at the table. Healthcare professionals should reflect the community they serve. And we heard this earlier. And a lot of times we hear it over and over and over, but work needs to be done. Racism fuels many social determinants of health and distrust in the healthcare system. And we have to get that trust back. We have to get that trust back. It is easy to talk about disparities, making change, but we must do the work. We must do the work. Reports are great. I think that NAM report is awesome. But when we talk about decades and decades and decades of healthcare disparities, again, talk is cheap. We have to do the work. We have to commit to change, making change, advocacy when it's not popular, demanding accountability and inclusion is hard work, but it must be done. Again, the talk is cheap. Research is awesome. Data is awesome. But it's what we do with it that makes it important. We have to make an impact. We can't continue to have our grandchildren and their grandchildren still at the same place where we are right now. Look at the underserved or the unrepresentation of Black people, Latinos, and other minorities in nursing. This has been going on for decades. A change needs to happen. We also need to support our nurses, right? Because our nurses are great. We know nurses are great. Nurses are very great. They're great advocates, strong advocates, right? And we have to continue to support health equity. We have to put these words into action. We have to call people out. If you know that, you know this task force exists and you look and see who the members of that task force, and you talk about health equity or any type of equity or equality, and no people of color on that task force, speak up. Speak up. I think we together can make change. The Black Nurses Coalition is making an impact each and every day. We started off as a small organization and have grown, and we continue to grow. The important and uniqueness of our organization is that we're boots on the ground. We meet people where they are. We're in the community. They trust us, and a trusted voice is so important in a minority community. Thank you.
Okay, thank you so much. That was excellent. And we're going to move right into our third speaker, and that is Dr. Deborah Stamps. Deborah Stamps is the Executive Vice President, Chief Nursing Education and Diversity, Equity, and Inclusion Officer. She also serves as the inaugural president of the Rochester Regional College of Health Careers. For over 30 years, Dr. Stamps has worked tirelessly to improve health system performance, ensure patient safety, and create opportunities for all those wishing to pursue health careers. Dr. Stamps began her career in 1989 as an LPN at Rochester General Hospital. From there, she continuously advanced her professional credentials as well as her clinical and management roles, obtaining associate's and bachelor's degrees in nursing, master's degrees in gerontological nursing and business administration, and an education doctorate. She is nationally certified as a nurse executive by the American Nurses Credentialing Center. Dr. Stamps has served as a nurse manager, chief nursing officer at Rochester Regional Health, and most recently as vice president of quality, safety, and innovation. Dr. Stamps is committed to workforce development in the community and is an active participant in numerous regional anti-poverty initiatives. She led the strategy to meet the needs for the Rochester community through expansion of the Isabella Graham Hart School of Practical Nursing, as well as providing home health aide and certified nursing assistant training programs. She currently leads the newly instated Rochester General College of Health Careers, a continuing education institution offering innovative and hands-on programs where students can earn an associate of applied science degree with a major in nursing, as well as other healthcare education. Dr. Stamps built an educational pipeline for healthcare workers in the community by offering tuition discounts, reimbursement, and support that will enable workers to move forward in their education and professional growth. The Wegmans Workforce Development Center, or WWDC, was her brainchild, creating a healthcare career development path under one roof. Dr. Stamps has developed paths and partnerships to provide diverse individuals with the education and skill development that they require to advance in a healthcare career, leading to employment. Under her leadership, diversity of the Isabella Graham Hart School of Practical Nursing has increased from 22% diversity to 67%. She has implemented and continues to lead the health ministry at Genesee Baptist Church, providing ongoing health promotion, prevention, education, and screening for the church congregation, the Rochester community, and the Northeast region of the U.S. Dr. Stamps received the prestigious Leadership Excellence Award at the 2021 National Diversity and Leadership Conference, hosted in April by Diversity First. Dr. Stamps' involvement in the community is also impressive, having been awarded the March of Dimes New York State Chapter Volunteer of the Year and the National Association of Negro Business and Professional Women's Club 2010 Sojourner Truth Award, the highest recognition this organization bestows, and is a national distinction for her many community activities. In 2011, she was inducted in the Monroe Community College's Alumni Hall of Fame. She is a 2012 graduate of Leadership Rochester Program, Athena Award finalist in 2012 and 2018, and AHA Women of Distinction Award. She received the Ralph C. Wilson Executive Leadership Award and the 2014 Genesee Valley Nurses Association Nurse Administrator Award. In 2018, she received the inaugural award from the Rochester Business Journal Women of Excellence Award, and in 2019 was awarded the Leadership Award for the Young Women's College Prep. Dr. Stamps is currently the second vice president for Chi Eta Phi Sorority, Inc., a life member of the National Black Nurses Association, and a life member of the National Council of Negro Women. She is a board member of the Rochester Chapter YWCA, recently completed a 4-year term as a member of the Rochester Academy of Medicine Board of Directors, and is a past board chair for the Rochester Finger Lakes Division of the March of Dimes. She's a member of the AONE New York Organization of Nurse Executives and Leaders, and is on numerous advisory boards such as Premier, Medical Quality Improvement Committee, and North Star Advisory Board. She is a trustee board member for Genesee Baptist Church, as well as leads the health ministry program. Dr. Stamps has been published in the American Association of Critical Care Nurses Procedure Manual, in the MedSurg Nursing Journal, Critical Care Journal, and in Nurse Leader. She has conducted research on the topic of horizontal violence. She has also published extensively on the innovative collaborative nurse leadership model, the Chief Nursing Officer Council, workforce development, and diversity, equity, and inclusion. Dr. Stamps earned her associate's degree in nursing from Monroe Community College, her bachelor's degree in nursing from SUNY College, Brockport. She earned a master's degree in the gerontological nurse practitioner program at Nazareth College in Pittsford, a master's degree in business administration from the Rochester Institute of Technology, and an education doctorate in executive leadership from St. John Fisher College. She is nationally certified as a nurse executive by the American Nurses Credentialing Center. And please, Deb, take it away.
Thank you so much, Kathy. Good morning, everyone, and thank you all for joining us this morning. I'm going to talk about opening doors and changing lives, our journey here at Rochester Regional Health, and the work that we have done here. So just to tell you a little bit about Rochester Regional, we're a large organization that spans just about 3,000 square miles from Western New York to up north in St. Lawrence. We are an integrated healthcare delivery system with 9 hospitals, the largest in upstate New York, seeing more than 230,000 emergency visits. We have more than 4,300 nurses, 2,700 plus medical staff, and so forth. And we also have post-acute long-term care beds, really touching every aspect of care of the members of our community. Health equity. We've started on this journey and really enhancing it many years ago on really getting to the point of eliminating any disparity in health that impacts health. And so the story that I'm going to share with you in our journey on increasing the diversity of the nursing workforce is really about achieving health equity. We also know that there are structural and other behavior type of barriers to achieving health equity. And the work of what we've done here at expanding the School of Nursing and leading to the College of Health Careers really addresses health literacy, education, financial security, and we're going to just show you today how we've impacted that. So back in 2016, our healthcare organization made a strategic goal to increase the enrollment at Isabella Graham Hart School of Practical Nursing. At that time, in 2016, we had 2 cohorts. We admitted about 60 students a year. And to double that by 2019 in a 3-year period, if anybody knows me, they know that I like to blow by the goals that are set. And we actually enrolled 229 students in the fall by the end of 2019. Over the years, we have created a nursing pipeline. We have high school programs where we partner with BOCES and other high schools in providing a healthcare medical program to high school students. We also have our own youth apprentice program, which is a paid internship for high schoolers in junior and senior year that really exposes them to careers in healthcare and also promotes professional and personal development. We have partnered in our community with other community colleges around our certified nursing assisted training, and our home care program has a home health aide training program. We have the Isabella Graham Hart School of Practical Nursing that I'll give you a little bit more detail on. And then in the fall, we achieved approval to stand up our Associates in Applied Science program. We have a number of partnerships with our area schools and of nursing colleges and universities, where we have a pathway from RN to BS. And then we want to also ensure that we have in those partnerships the ability for nurses to go on and obtain advanced degrees. At Rochester Regional Health, we've had a long history of nursing education dating back to the 1800s, where the Rochester General School of Nursing was the 12th nursing school in the United States and the 3rd oldest in New York State. Many have closed over time. However, Isabella Graham Hart School of Practical Nursing is still in place. This picture was the picture of our first evening cohort back in August of 2019. Of course, you know, there's no masks at this time, and these students actually graduated in June of 2020. Just to tell you a little bit more about Isabella Graham Hart, we're accredited by the Commission for Education and Nursing. We're a member of the Council of Practical Nurses in New York State. We were ranked as a top workforce training program in 2026 by the Rochester Business Journal. Our governing organization is Rochester Regional Health, Rochester General Hospital, and we are a member of the National League for Nursing. Just to give a snapshot of some facts, 95% of our students receive financial aid. That includes scholarships, grants, Pell and TAP, maybe also inclusive of student loans. We're a 1,200-hour clock hour program. We provide a certificate at the end of completion. We admit 4 classes annually. We do 2 admissions, August to January, a day and an evening of each. We also, it is 10 months. We have 30 plus FTEs that support the school, both from faculty and staff perspective and other system supports. Our attrition rate is about 11%. It's a moving target with over the last 18 months with COVID. Our job placement rate is usually pretty high. However, we've had a number of graduates that have chosen not to take jobs over the past year based on their home circumstances. And then about 35% of our students advance becoming RNs. The enrollment, just looking over the past few years, as you can see, we've grown our enrollment over years. So the blue bar is really our number of applicants, again, increasing the number of applicants. Those that are accepted are in the orange, enrolled in the gray, and those that graduate. For January 2021, we actually enrolled 164 students that are anticipated to graduate in November of this year. We do have a graduation next week of our June students. We are graduating 127 students next Friday. Really proud of them. Over the years, we have also been intentional, not only growing the school and the enrollment, because we know that there's a increased need coming and here right now, but we've also intentionally increased race and ethnicity of our student body. So if you look back in 2016, about 30% of our student body were of diverse backgrounds. We've actually totally flipped that to about 70% of our student body is of diverse backgrounds. That was intentional work on our admissions team, focused going out into the community, partnering with high schools and other community-based organizations to increase the diversity of our nursing workforce to meet the needs of our community. We also took a focus on gender, still a ways to go. Still have some strategic actions that are underway for that work, but we still have a focus to increase men in nursing. We can't do the work that we do without community partners. We partner with our accreditors and our regulatory agencies, but we also have community-based organizations that we partner with. We just can't do this work and support this journey without this. Our students have varying needs from a social, economical perspective, health perspective, and so really partnering helps us to achieve that. Also looking at our faculty and staff race comparison, we've made some improvement over time, again, with intentional focus on recruitment and retention. However, we're still not where we want to be. I will also share with you, also from a gender perspective, from a faculty perspective, we have opportunity. I'll also share with you that, we identified that we had some structural barriers, racist barriers in our system with the admission process. And I say that in a way to be transparent and to really, charge whether it's other schools of nursing to really look at their admissions process. And are we truly being inclusive as we can be? So once we identified those structural racist barriers, we actually removed a lot of them to be able to meet our needs as we go out into the community and potentially recruit. So building on the success of the practical nursing program, we really felt that we needed to continue that sort of roadmap that I shared in the beginning. And in order to do that, I went out and spoke with many schools of nursing, especially the associate programs. Could we, hold 5 or 10 seats to be able to have our students transition seamlessly? Long and short, there's a lot of demand in our region for nurses and the nursing programs. So I called up to New York State and asked how we could start up a program. They told me I needed a college or university, asked how you do that. They make it sound real simple, just fill out an application. Long and short, we completed a 700-page application. We submitted in January of 2020. We were approved for College of Health Careers in September of 2020. And our first program approved through the New York State Office of Professions as the Associates in Applied Science program. So this has really created that pathway from unlicensed high school all the way to registered nurse associate in applied science. It really creates a pipeline, again, for employment. We know that the pandemic has highlighted the fact that we have another great shortage among us. We know that organizations are really spending high dollars to fulfill their staffing needs through agency and premium pay. And, being able to impact that would be wonderful. We know that there's more opportunities around expansion of services and programs, but we can't do that and increase revenue streams if we don't have the nurses to be able to provide the care. We definitely know that when we have our own dedicated staff in our organizations, that quality is better. And that really does ultimately align with health equity, engaging the communities that we serve to really think about as you increase your education and your knowledge, you're creating education for your family and your networks that you are part of. And that really helps to decrease healthcare disparities over time because you're going to be able to make better healthcare decisions for you and your constituents. There's tons of community benefit from the nursing career pathway to promoting the next generation of nurses. We had a positive impact with this on our local colleges and universities, really creating that pathway from general education courses all the way to the baccalaureate, master's, and doctorate level. And then, of course, unfortunately, Rochester is the third poorest city for head of household females. And we can really impact the poverty level in Rochester by creating, educating members of our community to be a nurse, to have this professional progression, and then also increasing their salary and wages as they do that. Just to share a little bit about our associate's degree program, there's two ways to enter. We have a 1-year or 2-year option. We admitted a total of 20 students this first program or first course in March of this year. They anticipate graduation of our 1 year in December and our 2-year next June. We also are focused again on intentionally looking at the diversity of the student body. This will again helps us to know where we are today and where our opportunities are. The same with the gender of our students. Faculty, also, again, intentional recruitment and retention of a diverse faculty workforce. So in summary, we're improving accessibility to high quality care for our patients and family, creating the community workforce by increasing diversity, meeting staffing needs, increasing health literacy, economic mobility, and decreasing healthcare disparities. I know that was a lot real fast, but I want to make sure that we save some time for some questions. Thank you.
Thank you so much, Deb. So I do see that questions have been coming in as all three of you have been speaking. So why don't I call some of these out and see if we can go straight into the Q&A. Let's see. All right, these were, okay, here we are. So for Brenda, thank you for your leadership in the state, including your work on the Albany Area Police Reform Task Force. Race-based mistreatment and killings by police have become visible because of videos, but what happens in jails and prisons is less visible. And in Delaware County, this includes incarcerating those with mental health problems and refusing to continue MAT for people with addictions. Your work is an example of the Future of Nursing Reports themes. Thank you. So that was really more of a comment from Diana, but also for Dr. Robinson, thank you for shedding light on these disparities. And as an OBGYN NP of color, I try to tackle pregnancy-related disparities that you mentioned, but I believe there is an embedded notion towards females of color when it comes to pain tolerance, leading to Black females receiving care that is less sensitive to that of Caucasian women. Is there any advice on how to deal with the daily structural racism and ways to promote interventions that can change the care given to females of color? It's a great question. That's from Casey Ann. Is Dr. Robinson still with us?
Yes, I'm certainly still here. I think that is a great question. I find it to be very difficult. It is something we deal with on a day-to-day basis. Is when you deal with structural racism, when you deal with behavior that is supported by leadership, knowingly or unknowingly, it is very difficult to combat that. One of the things that my organization has done is actually in regards to this very thing is to meet up with leadership. And it's so funny because to meet up with leadership, they had to find value in what we're doing and who we are. And luckily, I was able to show that value. And we are working on some things to help address some of these issues. But it is very difficult to tackle. And you have to do it through leadership, because if on day-to-day basis, you're that end user, that person-to-person contact, well, that behavior has to be impacted and addressed from leadership, which is above. At our level, if you're dealing with that person on day-to-day or your colleagues, it has to come from above to really make an impact. But I do appreciate your question, most certainly.
Thank you. And then for Carol Ryan, a comment thanking you for being the voice of your patients, and that as nurses, we need to know that our voice matters and use it to advocate for our patients, whether they are a VIP or not. So clearly that story of yours really resonated, with Basira. Andrea is asking Dr. Stamps, can you please share some of the strategies you put in place at Rochester Regional to diversify your applicant base and your faculty and staff base?
Great, wonderful, thank you. It all starts with leadership commitment, first of all, to diversity, equity, inclusion. When we look at strategies for the student body, it's actually going into the community. It's going into the current workforce that we have. So certified nursing assistants, unlicensed personnel that may want to have a career in healthcare. We also want to make sure, one of the things we did was really look at the application process. Are we letting people know how to be successful in fulfilling their dream? So we have prep courses, we have supports in place to prepare for entrance into the nursing program as well. And then ongoing training and around diversity, equity, inclusion for the students. It's woven into our curriculum as well as for our faculty and staff. But there's plenty more and more detail around that, but just high level.
And we've got a comment here from Richard, who is inspired by the incredible work that you have done addressing the structural racism impact on social determinants and making a stream of jobs, education, and advancement for our profession. There is great synergy in the work of the Nurses on Boards Committee, which is our June 23rd panel talk, and promoting diverse nurses into leaders. And sort of in that theme, I noticed a comment a little earlier, which I did not mean to omit, from Nicolette, asking if there, and I think this is a question for any of our three speakers, are there any exemplars that we can use as a model to mentor emerging nurse leaders that will improve minority representation? I mean, you've all spoken a bit about this, but if anyone wants to chime in directly to Nicolette's question, any additional exemplars to mentor emerging nurse leaders? I mean, it almost seems like this is the work of all nurses. You're all doing this. We all need to do this. Oh, you're muted, Deb. I'm sorry.
Yeah, I'm sure that there are many, and this is actually one of the areas of focus for our diversity, equity, and inclusion team of the New York State Action Coalition. So we'll definitely be able to share some of these models and recommendations on how you can use somewhat of a toolkit methodology to implement in your organizations. That's our goal.
And we're also looking for examples. Those of you that are out there and of more examples that we can use to share with others, that's really how this works. We know that there's a lot of amazing work going on in lots of pockets of New York. And we just shared with you today 3 of those examples, but we know that there is a lot more that is being done. And we want to be able to highlight them, and we want to be able to showcase them. And we're trying to figure out ways to do that. So if you know of people, please send them our way.
I think that's it for our questions for today. And I want to thank all 3 of our panel speakers for their excellent presentations and for sharing, their journeys, which has really, I think, been invaluable towards advancing our, exemplars of how New York nurses, as Deb said, are actually working to address health equity. So I want to thank all of you very, very much. I think so we'll do a wrap up now, right, Deb?
Yeah, we're out of time. This goes so quickly. There's so much more that we would love to discuss. And this is really a call to action. We have 3 series in this summit. Today is the first. We have 2 more coming up. We have a slide for that as well. But we're asking people to join the NYSAC team in dismantling these health equities in New York. And together we can do this. We can use these examples. We're going to be coming up with an actual plan with strategies and from all of the information that we receive from these summit series, but we're going to have additional opportunities. We're planning something for the fall, which will be a little bit more of a interactive summit. So please keep your ears and eyes open, and we'd love to hear from you. There was, I think we provided our email addresses as well as Kennedy Blanchard. Kennedy is the communications person that works at the Center for Nursing, but is also, we man the NISAC webpage. So please stay in touch with us. Please connect with us. This is the beginning of another journey. We're kind of replicating what we did back in 2010 when we all decided that we needed to move on the IOM Future of Nursing report. And now we've got a new charge that we need to look at the NAM report and make a difference, because that's what we can do. Any last comments, Deb or Kathy?
No, just thank you so much for being with us today. You will get the evaluation for today to complete for your professional development credits. And we will also let you know when the link is available for the recording of today's session.
Yes, and I would just say, please do join us for the second and third sessions of our summit series. I can assure you that they will be equally interesting and engaging, and we would love to have you all there with us.
And have a great day. Enjoy the rest of this beautiful day. Thank you, everyone.
Thank you.
Thank you. Bye-bye.